All right, today we're going to dive into something called lifestylopathy. It's this really interesting new way to think about our health, and it all starts with a question that honestly I think a lot of us are asking these days. And here it is. How is it that we live in this age of absolute medical miracles, but so many of us just feel off, We're living longer, sure, but we're also feeling tired, disconnected, just not great. So what is going on? Yeah, and when you look at the numbers, it's pretty stark. Chronic diseases have become like the health challenge of our time. I mean, just look at this. Cardiovascular disease, that's about 1 in every 3 deaths around the world. Cancer, another 10 million people every single year. And our mental health, 1 in 8 of us globally are struggling. It's a lot. So to really get why this is happening, we've got to dig into that paradox we just talked about. Okay, so let's jump right in. The modern health paradox. Why is it that with all these amazing medical breakthroughs, we still feel like something's not quite right? Well, here's the deal. Modern medicine is absolutely brilliant in a crisis, right? If you have a ruptured appendix or a nasty infection, it's a lifesaver. It's like calling in the special forces, precise, powerful, and fast. But that same approach isn't so great with the slow, simmering problems. The chronic stuff that builds up over years and years because of how we live our lives. To really understand this, let's look at a patient's journey. Let's make this personal, because I have a feeling this story is going to sound pretty familiar to a lot of you. Okay, so let's talk about Maria. She's 52. And the best way to describe her situation is this. She's being managed, but she's not really being seen. The system is treating her symptoms, but it's missing the person. And this is what that fragmentation looks like in real life. Maria's got diabetes, high blood pressure, arthritis, and depression. So she's seeing 4 different specialists. Each one is focused on their little piece of the puzzle, right? So her prescription list just keeps getting longer, the side effects start stacking up, and the crazy part is no one's stepping back to look at the whole picture. Nobody is asking her about her food or how she's sleeping or what her stress levels are like. No one's connecting the dots. But what if Maria had a different option, a more integrated path? Just look at this. It's so simple, but it's so powerful. It doesn't start with another prescription. It starts with the absolute fundamentals. Week 1, just focus on getting her sleep schedule right, resetting her internal clock. Week 2, focus on stabilizing her energy with whole, minimally processed foods. Then, in week 3, start building resilience with some daily walking, maybe a little strength training. And week 4, bring in tools to manage stress like breath work and connecting with people. See, this isn't about chasing symptoms. It's about getting to the root of the problem. Maria's story, it's the perfect example of why we so desperately need a new way of thinking, a new health framework that actually connects all these dots and gives us a clear path forward. And that framework is called lifestylopathy. The name kind of gives it away, right? It's about the pathy, or the suffering, that can come from our modern lifestyle. And at its absolute core, it's about this balancing act between 2 huge forces. On one side, you've got this need to reduce the internal chaos in our bodies. The scientific term for that is entropy. And on the other side, you've got to strengthen the body's incredible natural power to heal and organize itself. And we're going to call that potential. So let's break that down. What does that actually mean for you and me? Think of entropy, or disorder, as anything that just throws your system into chaos and sucks your energy dry. We're talking chronic stress, junk food, not getting enough sleep, all that stuff. It basically puts your body on high alert, constantly firefighting. Now, potential is the exact opposite. It's all about creating order. It builds your energy back up. It lets your body do what it's naturally amazing at, repairing itself, renewing cells, and just plain healing. Okay, so this entropy and potential thing sounds cool. But how do we actually use it? Well, the whole framework is built on 3 really simple but really powerful guiding principles. Okay, principle number 1 is the entropy potential lens. It just means you start looking at every choice you make through this lens. Is this creating more chaos, or is it creating more order in my body? Simple. Number 2 is the compatibility principle. This one's huge because the perfect health plan is totally useless if you can't actually do it, right? So whatever you choose has to fit your life, your schedule, your values. And number 3, action as energy. I love this one. It means that every small, good choice you make is like putting a little bit of energy in the bank. It all adds up, building resilience over time. All right, so let's get practical. How does all this theory turn into a toolkit you can actually use in your day-to-day life? Because this isn't just about ideas, it's about giving you a real compass for your health. The whole practice boils down to 7 key areas or levers that you can pull. And honestly, the best part about this is that these are things you already have access to. They're within your reach right now, today. So what are they? Here you go. You've got the ones you'd expect, the big physical pillars: your breathing, nutrition, movement, and sleep and recovery. But look, it doesn't stop there. It goes deeper. It includes exposures, what you're exposed to in your environment. It includes your relationships, and it even includes your sense of meaning and purpose. See? This is what we mean by a truly holistic approach. It's the whole shebang. I think this is the perfect way to sum it all up. This framework isn't a map. A map gives you a strict, rigid route. Turn left here, go straight for 2 miles. It's one size fits all. This is a compass. A compass doesn't tell you the exact path to take. It just points you in the right direction. It gives you the freedom to navigate your own life, to find the path that works for you. And really, that gets to the heart of what this is all about. You know, the goal here isn't just about tacking more years onto the end of your life. It's about adding more life to the years you have. It's the difference between just surviving and actually thriving. So that brings us to the final question, and this one's for you. Looking back at the 7 levers, thinking about that idea of chaos versus order in your own life, what's just one small thing, one simple choice you can make today to start moving your compass needle just a little bit more toward health?